Thank you for watching Healthy Nation. I'm Pat Murphy-Stark. In an appearance-driven society, body image and the pressure to look good weigh heavily on everyone, but arguably more for women than for men. So it makes sense that the illness that many women fear the most is one that targets the most obvious sign of femininity, the breasts. Breast cancer will affect more than 200,000 American women this year. That means about 1 out of every 8 women will be told they have breast cancer at some point in their life. But here's a statistic you might not know. Breast cancer doesn't just affect women. This year, around 1,500 men will also be diagnosed with the disease. And while a diagnosis can be startling, the options for treating breast cancer have never been better. Thanks to earlier diagnosis and better treatment, there are more breast cancer survivors today than ever before. Let's hear from Dr. Holly Atkinson to find out what breast cancer is and how to recognize the signs and symptoms.
The first step in understanding breast cancer is knowing the anatomy of the breast. The breast is made up of 5 main parts: the lobes, lobules, fat, milk ducts, and stroma. During pregnancy and breastfeeding, the lobules produce milk, which travels through the ducts to the nipple. Inside those milk ducts is where most breast cancers begin. This happens when cells turn cancerous and start to grow unchecked. As with other cancers, these cells are abnormal and typically divide and grow rapidly. This is why you may feel a lump. While the milk ducts are the most common site of breast cancer, the disease can start anywhere in the tissue. Breast cancers can spread via the lymph vessels in the breast. These carry a colorless fluid that supports the immune system and removes waste from the cells. These vessels are connected to the lymph nodes, a type of gland located throughout the body. This is often the first place cancer will spread to beyond the breast. There are a number of different signs and symptoms of breast cancer. The most common is a lump found in the breast tissue. This is why it is so very important you perform self-exams. Breast cancer, like all cancers, is best treated if caught early. Now, if you want to take notes, you can hit pause and write down the following information. Note any symptoms you may have experienced. This is important information you'll need to share with your doctor. The signs and symptoms of breast cancer are spontaneous clear or bloody discharge from the nipple, retraction or indentation of the nipple, a change in size or contours of the breast, any flattening or indentation of the skin covering the breast, redness or pitting of the skin over the breast. Any one of these signs can show up without the presence of cancer. Only your doctor or an oncologist will be able to tell you if you have breast cancer. So if you think you may be at risk, and especially if you see any of the warning signs, go see your doctor. By the way, if at any point in your diagnosis or treatment you want to seek a second opinion, feel free to do so. This is your health we're talking about.